Hello, everyone. Again, welcome back to this YouTube video channel, channel for dentists and other healthcare profession. Today, I'm invited Dr. Richard Downs, one of the long-term doctor, clinician, and inventor of different things in his practice. Today, we have him introduce you guys about how you can screen sleep apnea patient and how you identify a candidate for your office, and potentially you see the benefit of helping someone, especially there is a high number of people who have sleep problem and sleep disorder, but most of general dentists, we don't recognize it, we don't see it because we just so busy day in day out doing dentistry and just forget about the patient overall health. Instead of focus on oral health only, we just focus on that, but we're missing our bigger picture, the systemic condition, sleep disorder, eating disorder, health, overweight, all kind of things. So let me have Dr. Richard Dow introduce again who is he, and then he's gonna jump in some introduction. Dr. Richard Dow, the floor is you.
Thank you so much. It's nice to see you again, Locke. I appreciate that very much. Yeah, I'm retired a little over a year now from my practice in Dubuque, and started seeing sleep apnea patients and screening for them about 15 years ago. Now I teach it full time. Well, I shouldn't say full time, but I do a lot of work online with chiropractors and dentists, training them in how to do and treat and diagnose obstructive sleep apnea. And today I thought we'd just go through the basic screening process, not get into a lot of treatment, just to kind of give people an idea what you would look for and why.
Sure.
Yeah. So do you want me to show some slides then?
Yeah, I mean, if you whatever help the other beginner to understand,
All right. Let me get my okay, I'll need to have you enable my screen share.
Sure, I will do this 1 second, okay?
Co-host, I think. Yeah.
Give me 1 second.
My screen share is one of the Hawaii scenes back here. One of our favorite places to go is Kauai. We'd like to go to Kauai. So we've been there about 26 times.
Wow.
Yeah.
Long time. Just like my wife and us, we only go to Waikiki, so we go there quite a lot.
So we haven't gone for the last 2 years because we left there last time we left there, COVID was just coming into the United States. And so we've kind of stayed away from there because the isolation you have to do. So do you know did you share the screen yet? Or
give me 1 second. I'm trying to.
You just go up to my
make
name
a host.
where they have
I got it. That's it. You
are.
Right,
very good. Perfect. Okay. All right, go. So I'm going to go ahead and bring up a slideshow here, a presentation. And can you see that screen okay?
Absolutely.
Okay. So I'm going to go to the beginning here, excuse me. This is the teaching school that I have. It's called Sleep Balance Academy. And it's mainly administered by Dr. Joseph Silk, who is a double board certified in sleep medicine, and then myself. And the reason we should be all screening this as dentists is that because in the American Dental Association has mandated that we do so. I can tell you that it has to be done. So if you're not doing it, I'll give you some basic outlines. Even if you don't want to treat it, at least screen for it. Okay. So we combine the expertise of dentists, chiropractors, and medicine. I misspelled medicine there. And we offer a way to overcome the limits now blocking sleep apnea care. We have an inexpensive program, and we have sleep education, a quick start formula, and we have telemedicine through myofunctional therapy that can be done remotely with your office. So our myofunctional therapists can actually treat your patients from anywhere in the country via telemedicine. This is Dr. Zelk, and he's been passionate about sleep apnea. He's worked with dentists for more than 20 years, so he's very familiar with dentists, and he actually administers and makes and dispenses oral sleep appliances himself. But he's also a very big advocate of combination therapy, so we teach that extensively in Sleep Balance Academy, so that you don't just rely on sleep apnea oral appliances only. We have lots of other treatments that we can show you. And this is myself. I have a couple of fellowships and a diplomate status in the Mini Implant Association. This is Shirley Gutkowski. She is our myofunctional expert, the person that I was talking about that can do myofunctional therapy for you. She can train your office, or she can treat your patients remotely, either way. And she does that through our academy. And she's probably the most knowledgeable person on myofunctional therapy I've ever met. She's amazing. Now, here's the ADA mandate that I mentioned before. They recommended that we should screen patients for OSA, that's obstructive sleep apnea. Okay. Now, when the ADA says that, like they did back in the time when they told us to start screening for cancer, now it's become commonplace. It's the standard of care. And this was issued in 2017. So if you're not doing screening for obstructive sleep apnea, probably you're not keeping up with the standard of care. The sleep-related breathing disorders spectrum starts from normal, goes up to primary snoring, then upper airway resistance syndrome, and then we get to the sleep disorders where we get mild, moderate, and severe, okay? And then you get to the point where people are extremely sick, and we wouldn't treat them at the very extreme end of this program, but we would like to treat patients while they're just getting started with the progression of this disease, okay? I don't expect you to know all the meanings of all those different things right now. It's not the scope of this program. Statistics, you asked for some statistics, Dr. Wynn, and so I brought some. There's estimated to be about 70 million people with obstructive sleep apnea. That actually is growing because the population is getting older, and older Americans tend to suffer from this more than the younger. But 1 in 10 children have issues with obstructive breathing, and that's a surprising number. Many of them need archway expansion and examinations from their ENT physician for tonsils and adenoids to make sure that they're getting adequate breathing while they're sleeping. So much of this can be treated by dentist and with consultation with your physician. And the CDC has labeled obstructive sleep apnea an unrecognized epidemic, and largely is unrecognized as an epidemic. It's amazing how many people are not diagnosed by their primary care physician. Even they don't even ask questions about your sleep many times. And then about 5 years ago, there was estimated there was $154 billion in losses each year in this country due to complications of obstructive sleep apnea, lost work, accidents, heart disease, stroke, dental disease from bruxism, attention deficit hyperactivity disorder, low IQ in children, inability to concentrate, depression, and high blood pressure. So, and even the Exxon Valdez and 3 Mile Island accidents are related to people who suffered from the sleepiness caused by obstructive sleep apnea. By the way, obstructive sleep apnea is just one of more than 100 sleep disorders, but it's about 98% of those that are suffering. So we're treating just these, not the other ones that are more specialized.
Is it? I just want to interrupt you. It's interesting that the CDC label it an unrecognized epidemic.
Yes.
That's amazing.
Yes, it is. It's an epidemic, and the fact that people don't know that it's that it's such a big problem is. I mean, the average dental practice, probably 25% of your patients could be suffering from this. Okay.
Is it related to sometime the modern lifestyle?
Yes,
Eating?
it is.
Yeah.
I think our faces are getting smaller, Dr. Nguyen. The faces are getting narrower. The arches are getting narrower. That's what you should be looking for. You can see this bicuspid drop off on a lot of patients. I'm sure you don't know what that means, but when you look at the lower teeth and you go from the incisors backwards, and all of a sudden there's a dip down in the occlusal plane in the bicuspid region as it goes posterior. You look for that. You look for scalloped tongue and flabby uvulas and other things.
So you're saying like a deep curve of speed?
Deep curve of speed, deep bite, class 2 division 2, class 2 division 1, narrow arches. All of these are signs of obstructive sleep apnea. Any type of class 2 occlusion, but even class 3 occlusions can be a problem. And so, and then of course, you want to see class 1, but sometimes those people are suffering as well. And the fact that we don't get our wisdom teeth in is not an evolutionary consequence. It's due to our modern, smaller jaws. And so really everybody should be getting their wisdom teeth in, but we're not, okay? So you can see that sphericity goes from, from normal, and this is called the apnea-hypopnea index. That means apnea means stop breathing, hypopnea means restricted breathing, and an index means this is the number of times per hour. So when these events occur on a sleep test, anything below 5 is considered normal. Anywhere from mild is considered 5 to 15, moderate 15 to 30, and then anything over 30 is considered severe. This is not a perfect way to measure sleep apnea, but it's most common. Okay. Generally, dentists treat in this area right here mild to moderate with their oral sleep appliances, but if a person can't get along with their CPAP, then they also can be treated with a sleep appliance, even if they're severe. Here's some of the problems that are caused by obstructive sleep apnea. As you can see, it affects a lot of different organs. You can see here, depressions, forgetfulness, the irritability, headaches, restless sleeps, daytime sleepiness is a big one, snoring and dry mouth. This can affect a caries level, gasping for air, sore throat, night sweats, attention deficit. Many children, about 50% who have been diagnosed with attention deficit disorders actually don't have it. They have sleep apnea, okay? This one says 40%. I think that's a conservative figure. 73% of Alzheimer's diseases are related to obstructive sleep apnea, depression, stroke, diabetes. It's a huge potentiator of diabetes because it increases the sugar resistance or glucose resistance. Heart rate failure, drug-resistant hypertension, coronary heart disease. Our atrial fibrillation is a big one. If anybody has atrial fibrillation, you probably should be testing. Acid reflux is a big one, and obesity. There are more than these, and a person definitely grinds and bruxes their teeth, can destroy the nice dental work that you put in, and the crowns and bridges that you place.
That's incredible.
Yeah.
Wow.
That's why dentists should be looking at it too, because if you're wondering why people are bruxing, and by the way, Dr. Nguyen, a lot of people are giving injections of Botox into people who are bruxing under their jaw masseters. I don't think anybody should do that until they do a sleep test on the patient, because people are clenching to open their airway when they're sleeping. And if you suppress that, you're going to give them, in my opinion, and I'm pretty sure that a lot of people believe the same thing, that you're going to worsen their sleep apnea. And that's not.
Wow, that's interesting. That's good to know.
Yeah, so don't do any type of Botox for bruxism without first doing a sleep study, okay, or sending them away for a sleep study. All right. This is called the Epworth Sleepiness Scale. This is one of the things you can use in your office. You have about 7 questions here, and you rate them from 1, 2 to 3. That means light chance of dozing, medium chance of dozing, or a high chance of being sleepy or dozing. And that's why you're sitting and reading, watching TV, sitting inactive in a public place or a theater, as a passenger in a car for an hour without a break, lying down to rest in the afternoon when your circumstances permit, sitting and talking to someone, sitting quietly after lunch without alcohol, and in a car while stopped for a few minutes in traffic. Now, these questions, you rank them, and then anything above 10 is considered a significant sleepiness. And these are often wanted by the insurance companies in order to qualify for getting insurance benefits. So this is called the Epworth Sleepiness Scale.
Okay.
ESS.
Wonderful.
And now I incorporated that into our Sleep Balance Academy policy, and I'll show you our screening form in just a moment. So the ADA policy then, dentists are encouraged to screen patients for sleep-related breathing disorders. You can refer them to the appropriate physician once the patient has a positive screening. You need to start the screening. All patients should update the health history. You can look for, do a good physical exam if they have like diabetes mellitus 2, cardiovascular events or GERD, AFib, weight gain. These people are high risk for obstructive sleep apnea. And you can do the screening test with the Epworth Sleepiness Score, or another one is called a Stop Bang or Berlin, and you just should look at their BMI and their age. Okay, so those are all things you'd want to look at that might indicate that you'd want to screen for sleep apnea. Now, when you look in the mouth, these are the things you look for. This is a schematic, of course, but you'd look for scalloping tongue. You'd look for elongated uvula. This airway that's open in here and here, if it's completely occluded by the tongue and you can't see the back of the throat, then that's called a Mallampati 4, and you would say that that's another high indicator of obstructive sleep apnea. So sometimes the tonsils come in too far from the side, and the tongue is maybe swollen and too high. So these are the things you look for. So you want to have a good relation with your local sleep partnership, with sleep labs. You want to have a good relationship with them. You want to have a good relationship with your local primary care physicians. And the dental office can dispense sleep testing with telemedicine or a sleep doctor interpretation. We can do that for you through Sleep Balance Academy if you want to. I'll show you our home sleep test sites if you'd like. And so one of them is the one called onlinehomesleepstudy.com. And that one is a place where you can go and order a sleep test. It's kind of slowly bringing up that site. Hold on here again.
What the cost if the patient don't have insurance or they don't know whether the insurance cover?
Okay. Well, here's the cost of a sleep test on my site. It's pretty low. I'll go to the store and we'll look at the sleep test. Now, if you ordered a sleep test here, the patient can get one, and the first one is called the Aries home sleep test. Number 1 is still loading a little slowly, but I'll show it to you here. Now, the Aries is this one will be sent to the patient, and it costs $330. Okay.
Mm-hmm.
This is a lot less expensive than going to a sleep lab. And this comes back included with an MD diagnosis. Okay. So that's included in this fee. That's a pretty good price.
Mm-hmm.
And many patients, this is less than they'd pay to go to a sleep lab with their deductible on their insurance plan.
So this is usually like a device, right? Like you just, that's on the picture right there?
That's the device. It fits on the head,
mm-hmm.
and there's a little cannula that goes in the nose. Mm-hmm. And then you'll wear that for 2 nights, and you'll send it back to the company, and it'll come back with a report, mm-hmm. and I'll help you interpret them. Okay. Mm. Yeah. This is a very good sleep study. Now there's another one. We have other ones also. And so we have one called the Night Owl, which fits on one finger, that one there. This is kind of a look at the report. And then we have another one called the Sleep Image. But again, the prices are good. Like this one here doesn't come with the physician diagnosis, and then this one does. Okay.
Okay.
Okay. So they're all different prices. And then for doctors, you can order many of these. If you want to order them in bulk, then you can get them at different prices. Okay. Most of the prices in here are for not for doctors, but for the general public.
There's so many devices. Is there any particular device would you consider like having a patient to give it a try at the beginning?
The one that least disrupts sleep is this one. Okay, the Night Owl. Okay. And also this one. They're easy. They're just one finger. Mm-hmm. But this one's not very bad. It's a very accurate. You get a little more information with this one than you do with this one. But they're both FDA approved sleep studies. Okay, you can diagnose with these. Okay, all right. Let's go back to the slide program here, and and then there's the watermark. That's the one I just showed you. It's called the water, and that's called an Aries, but I get it through this company. So let's go to the next one here. Then we can go to treatment, but I'm not going to go over treatment today. I told you I wouldn't. Mm-hmm. So in other words, I'm just saying, rather than a CPAP, you can get things like the Bongo RX, which is an EPAP device. You can get a little suction device in your mouth, call it INAP. We have lots of treatments other than just sleep appliances, and we can train you in our school. Here's a number of different types of oral sleep appliances. There's more than 100 of those, and they all have their place. Okay.
So at the treating doctor, someone had to know familiar with all those devices. So that's where they can give the patient the option. And every case is different, right? So you had to try it. And
I don't think you need to know all 100. You get maybe 6 of the ones you like the best and use those. Okay. I don't think you need to know all of them. No.
Okay.
All right. Now, this is one of the screener. This is something I really recommend for screening. If you want to do something more than just the paper forms, if you'd like to have a device in the office that would screen patients, this is a great screen. This is an FDA cleared high sensitivity pulse oximeter, which is racially unbiased. In other words, there's a lot of products out there that are racially biased for pigmented skin. And this one is not. This one's approved for all racial types.
So this one called Circle
Plus.
Circle Plus.
And you can buy this on the Sleep Balance Academy site. I'll show that to you. But it's the only non-biased ring that I know of. It's a high sensitivity pulse oximeter. It does oxygen levels every second. Okay, like Oura Ring won't do that. Apple Watch won't do that. Okay, and it'll track it all night long and give you an oxygen desaturation index, or the amount of events per hour, kind of like an AHI. Heart rate variability, blood pressure, temperature, sleep stages, T time. That's an amount of time below 90% when you sleep. Sleep latency, sleep duration, and it comes right to a phone app on your phone.
How much is this one, doctor?
That's $299.
And after you have the data, you would send it to you guys to, or let's say to the, I mean, the treatment, the treating doctor should able to see this, or if the patient order
the patient
from
will
you
send
guys.
this to you.
Mm-hmm.
The patient will send this to you by phone. In other words, all they have to do is hit a little arrow at the top of their report, and I'll show you one right here.
Mm-hmm.
Okay, but here's the sleep studies by Sleep Balance Academy, the Night Owl, the Sleep Image, and the Watermark. And there's the two ordering websites: sleepbalanceacademy.com, mostly for the professionals, and onlinehomesleepstudy.com is for patients.
I see. Now I understand. Because last time you introduced me to website, I got confused. Like I say, why there's so many different things. So one for patient, one for provider.
Now listen, there are 7 states now that don't allow dentists to order home sleep studies, but the patient can go here on onlinehomesleepstudy.com and order their own. There's no law or board rule against that. So if you can't order them, just send your patient here and then have them order it.
Because they need to find out how they feeling, because sometimes they don't even know whether they have a problem.
Right, exactly. That's exactly right. Now, I recommend the screener device. You don't have to go to this. If you're just going to screen and refer the patient, that's fine. You don't need these, okay? But if you're going to go on to treat and you want to know more about the patient, then you go on to the sleep study.
So in other words, let's say the patient, can you go back to the website? Let's say the patient ordered and they don't have a provider, they can contact the website Sleep Balance Academy. Some provider can take care of them.
If the patient wants to order a sleep study, they go here.
Right, okay. But after they, let's say after they done the study, they found out that they're not doing well, they have problems. What do they do next?
Well, I talk to them. Okay. Because I see their study. And I send it to them and I tell them the next step to do. You need to go see their dentist, or they need to go to see their physician. And I just tell them they're going to need a prescription from an MD, and then what to do next.
Okay. All right. Thank you.
Good. Now this is the sleep ring, the ring that I showed you, the Sleep Plus, and you can see. Here's what the report looks like. This is the ODI up here. You can see it's 9.8. That's should be less than 5. And this is the average oxygen rate overnight, and this is their lowest score overnight. And then you can see their heart rate, and your T90 score is right here. And then the high and low heart rate, their sleep stages are here. And then how long it took them to go to sleep, and the sleep time, and when they started going to bed, when they turned out their lights, turned on the machine. So and this is not hard to read. It's really one.
Dr. Dow, I have a question.
5, 6, 7.
Can the patient use the insurance to buy this or no?
I don't know that all insurances have the same rules. I know that this ring has been accepted at a very large medical facility, medical insurance company in California. What is the largest one there? I can't remember it. Anyway, and so now it's accepted for remote patient monitoring reimbursement. Okay, so this is the only ring that has been approved for that.
Yeah.
In California, it'll probably roll out in other states as well.
Okay.
So now, here's me. I have the EPAP in my nose, and at 80% wear, just the EPAP and no oral sleep appliance. And you can see I have a 9.1. But now, the next one, you'll see I'm wearing the Bongo and my oral sleep appliance, and look at the scores: 1.8, 2.6. Now, with the combination treatment of both the EPAP and the oral sleep appliance, I'm in normal range. These are both of me, okay? So you get an idea now. You can use that ring for titration when you do a treatment you can use that ring to help you figure out where you've got it in the right position and you're getting the results you want. Once you get good scores like this, then you do another sleep study to confirm it. Here's one oral appliance called a Herbst. Okay.
Mm-hmm.
Now, what do we suggest you use? Here's the screening form that I'm recommending. We're getting close to done here, and I want to show you. So in the Sleep Balance Academy, I developed this form. Up here is the medical questions, and you can see they're weighted with scores, 3, 7, 2, see that? Mm-hmm. Here's the Epworth Sleepiness Scale in the middle. Okay, so that's still there. And then at the bottom, you'll have a few dental and spine questionnaires, and those have scores. Mm-hmm. And then you total up all the scores, and then if it's over 7, then you recommend a sleep study, or you send the patient to a doctor who treats it. This is the one form, and the only form you need to screen a patient is right here.
Got it.
Okay, good. Now,
how do we get that form?
Well, you need to be a member of Sleep Balance Academy, but I'd be happy to send it to anybody who wants it. Okay. All right. Now, the next one here is the child assessment and screen form. And as we said, 1 in 10 children have a problem, and we have a different set of questions here for the children. Okay. Mm-hmm. Whether they're bedwetters, if they wake up at night, if they wrestle around and sweat while they sleep, if they grind their teeth. When I was in school, grinding your teeth, they told us was normal. It's not, okay? And even children that snore are in here. And then also their speech problem issues. There's a set of questions for that, okay? And if you're into ortho, then we have some cephalometric questions, okay? Mm-hmm. All right. Now, the next one here is a refusal form. If the patient refuses treatment or doesn't want to be screened, or if they've been screened and it's found abnormal and they don't want to go see anybody for treatment, then have them sign a refusal form. All students of Sleep Balance Academy have access to all of our forms. We're just showing you a few. Mm-hmm. And that's a simple form called a denial or refusal of treatment. I think you need something like that to protect yourself. And then there's a way to write your SOAP notes. When you're writing a SOAP note, we took, like, this is a SOAP note example of a severe obese patient that I took in, and she had, you see the S and the O, mm-hmm. and the A and the P. You want to write your notes like this, so insurance companies will not give you a hard time. Yep. When you're making your submission for claims. Okay. All right. And then let's just go and let's go to and then the referral forms. I'm not going to go over referral forms. You can get those. Physical evaluation forms. Now, these are for people who want to do more in sleep medicine. We have all the ICD-10 codes and different things here. But this sleep exam form is very comprehensive and nice and useful. And then, oops, I went the wrong way. And we'll go to the next slide. And there's a super bill with all the different kinds of billing codes. I'm not going to go over that. Mm-hmm. So here's the simple steps. You screen the patient. You have adult and child scoring forms. If all you want to do is that, you will satisfy your ADA requirement. And then you do a referral to whoever wants to treat them. But you don't have to do anything more than that. Your hygienist could gather this information before you go in the room. And you want the refusal form if they don't want to do it. The referral form, you want to make sure you have SOAP notes. If you want to progress to sleep study, we'll help you with that. Super bill, informed consent, and treat. All right. So essentially, that's it.
Thank you so much, Dr. Richard Dow. I have a couple of few questions. How many, for your academy, how many week or day that we have to attend to finish your training?
It's all done online.
Okay.
So when you join, you go through the modules. There's there's 0 through 3 modules. So there's actually 4 modules. And there's 25 hours of PACE approved continuing education there.
So online, so you take your time whenever you can, just finish it. But on average, how many days do you think a person would be finished it?
If you were diligent, I'm pretty sure you could get finished with everything in 4 to 5 days.
Okay. So probably typically 2 weeks for somebody who's spread, so to take some time.
Yeah. Yeah. You don't have to. Yeah.
And so the academy, the cost, Dr. Dow?
It's $964 a year.
Oh, okay.
So
when you enroll, you able to take the course. The membership is the same at. Oh, okay. Is that right?
Same. Yeah, membership gives you access to all the courses. Yeah.
How many member in your groups right now that you've been training?
We're started out, but we've got about 20, a little over 20 people in the academy right now.
Yeah. Do you work with across the state provider? The 20 people, are they spreading around the whole nation?
Yeah, it's all over the country. Yeah, everybody's all over. Yeah, we got quite a number of chiropractors in there. I'm committed to bringing them into this profession. I think that they're underutilized, vital key to addressing this huge problem. You see, the medical profession is graduating fewer specialists in sleep medicine, so the bottleneck's getting worse, and they're also not doing enough testing, and they made the testing difficult and expensive, and I'm making it easy and less expensive. That's my goal. We need to get them screened. Even if you don't treat them, at least screen them. Find them, get them to somebody who needs it, who can treat them.
I agree. So let me ask you, so as far as dental insurance, do they reimburse anything for dentists to screen?
Oh, yeah. I'm seeing an average of, I would say, $2,500 to $3,500 per case. That's the reimbursement levels right now.
From medical insurance or dental insurance?
Medical. Always do medical. Always do medical. And by the way, there's a man out there teaching a dentist to actually form a durable medical equipment separate entity. They're getting better reimbursements if you do that. I'm not doing that, but I could probably get you in touch with somebody who can teach you how to put that together.
Wow, it's been a wonderful presentation, Dr. Downs. There's so much to learn, and this is what it's all about for my channel, is to invite somebody who is knowledgeable and expert on what you do. And I'm sure you have much more thing to share, but I hope we're going to keep this for now, and we'll see everyone next time. Thanks for your time today. Really appreciate it.
You're welcome. Thank you. Thank you for the privilege of speaking with you a lot.
Thank you very much. Have a wonderful weekend, sir.
Okay. Bye-bye.
Take care.